So we are looking at the welfare state policies in the UK and comparing them to welfare state policies in other continental European countries. And when we compare them, we can see that really the UK is a reluctant welfare state. So as percentage of GDP, it's spending much less on health, on public education, on pensions and so forth. And the question then, of course, becomes with the financial crisis and with Brexit, and a lot of private debt is really based on mortgages, but also is becoming more consumption related. And with a potential crisis, increases in inflation and potentially also the interest rate, that will bring a lot of families to the brink of bankruptcy or even to poverty. And so, of course, a lot of people, and specifically politicians, more left-wing politicians, would say increasing welfare state spending, we need to increase welfare state spending in order to counterbalance these kinds of effects. And the question then really becomes, is more always better, or is just better? And what this research really shows is that there is only a very, very weak link between welfare state spending, so spending on health, public health care, spending on pensions, spending on public education, and actual outcomes. And what we are saying is really that welfare policies are really not a means, or they are just a means to an end, and we are really interested in outcomes. And so what is weaving through this whole policy report as well is also apparent in this contribution, that it's not just about the funding of policies, but the design of policies. And really the design is important to generate this link between the funding and the outcomes.